Welcome to this workshop on the European Reference Network and how they can add value to clinical research. It's a workshop co-organized by RD Action, the European Commission, and the European Medicine Agency. And I can see that there is a lot of knowledge, experience, and expertise around the table, so no doubt that there will be a very fruitful discussion, particularly tomorrow when we have time to discuss together. Today it's more about sharing information about what we do and how we can mutually benefit of the work we are doing. My name is Isabelle Moulon. I'm the Senior Advisor on Stakeholder Engagement at the EMA, and I will be co-chairing the first session together with Valentina. And you want to say a few words?
Good morning. Yes, I'm Valentina Bottarelli, Public Affairs Director in ERNs. ERNs is also partner of the joint action that I'm happy to represent today. And I'm happy to say that this is the last workshop of a series of meetings and workshops that have been organized and supported by the joint actions for rare diseases for many years now that help the development of the concept, the preparation, now the deployment of European reference networks. And we are honored that this workshop is co-organized with DG, SANTE, the European Commission, and the European Medicine Agency, which we thank for the efforts and for the support. And I'm also pleased to say, as I represent ERNs as the patients, that 10 patient representatives, apart from the staff of ERNs, are here amongst all the distinguished guests. And they represent different European reference networks and the voice of patients in the networks.
And before I give the floor to the Deputy Executive Director of the agency, I would like to give you some few housekeeping of my whole list here. So first of all, there is a live broadcast of this first day of the workshop, which means that there are some constraints for you, particularly when you want to speak. You have to switch on your microphone and you need to introduce yourself. And when you finish your talk, you switch off because the cameras follows the microphone. So if there are several microphones, then the camera goes mad. After the workshop, there will be a video recording and a PowerPoint presentation published on the EMA website. And then, in case there is an emergency or a fire alarm, for example, you will hear a message and we will have to follow the instruction. If we have to leave the building, the exits are just outside of this meeting room, so it's very easy to leave the building from here. Coffee and lunch will be served just outside the meeting room where you registered. And for those who have gray badges, if you need to go outside of the building, you have to be aware that you cannot enter the building anymore. So before you leave, you have to tell EMS staff that we need to go downstairs and pick you at the time you want us to pick you. And finally, something very important, I would like to remind all the speakers that they have to be aware of the time. The agenda is very, very busy today. And all the chairs, so first Valentina and myself, we have to stick to the schedule. And so we'll be very inflexible in terms of timekeeping. And on this note, I hand over to Noël Wathion, the Deputy Executive Director. Please, Noël.
Thank you, Isabelle, and good morning, everybody, and welcome to the agency also on my behalf. Although I'm the Deputy Executive Director, my full-time task now is chairing the EMA Brexit Task Force, so looking at all the impact of UK leaving the European Union on the agency's activities, including the relocation of this agency in a two-step way from London to Amsterdam. But nevertheless, this is a very important workshop, and the title of the workshop being How European Reference Networks Can Add Value to Clinical Research. The agency firmly believes that there is indeed the possibility to add further value, because the establishment of the European reference networks and their implementation could potentially represent a very valuable asset for the agency, not only for the agency itself, but also for the network with the national competent authorities, with all our stakeholders, with the European Commission, where awareness of their existence and monitoring of their evolution should be promoted. And we think about a number of areas such as orphan medicines, pediatric medicines, advanced therapy, medicinal products, scientific advice, guidelines, real-world evidence, registries, MPRIMA and NCEP networks, access to very specialized expertise, and then also perhaps as a consequence of that, an enrichment of our expert database. So far, we had a number of interactions over the past couple of years, in fact, primarily starting as of 2017 with a presentation at the annual MPRIMA meeting in last year, increasing awareness internally through so-called lunch talks that we are having, also having a channel of exchange between the ERN coordination group and the agency. And also here we had further elaboration at the multi-stakeholder workshop on pediatric regulation on the 20th of March of this year. So this workshop today, and I will not dwell on the expected outcome, the aim of the workshop, etc. Other colleagues will be doing that, but is seen as a next step in order to further promote the interaction. Now, one little how should I say it, caveat I would like to put is that the agency currently is in a business continuity planning mode. That will not go away. In fact, we will have to introduce further reprioritization of our activities, certainly when half to 6 to 9 months of next year, we will be fully occupied with trying to establish ourselves in a new member state. So that will come with reprioritization of activities. We will probably, after within the next couple of weeks, have a clearer picture on what that would mean. And then, of course, you will be informed if there is also any potential impact on a temporary basis. We have to stress on a temporary basis, but I think everybody will understand that we are going through very challenging times at this moment in time, and it will take some time before everything is fully established. Now, with these words, it was perhaps not the most positive of my intervention, but nevertheless, we have also to be a little bit realistic about what can be achieved in these very demanding times. And with that, Madam Chair, I hand over back to you.
Thank you very much, Noël. So I think now I hand to Valentina.
Yes, I'm very happy to present now Victoria Hedley. Victoria is policy manager at the University of Newcastle. And with the University of Newcastle and the team of Professor Kate Bushby, she leads the Work Package 6 of the Joint Action for Rare Diseases, RD Action. Work Package 6 is the work package in charge of policy and integrations, and Victoria particularly has to be commended for the work done so far in support of European Reference Network and different workshops like this one.
Thank you very much, Valentina. Okay, may I have the slides on the screen? So thank you for the introduction. So my name is Victoria Hedley, and I'm speaking to you this morning as a representative of RD Action, which is the current joint action for rare diseases. So a joint action For those who are not aware, this is merely a type of funding mechanism which is used by the European Commission. I'm a little biased. I think it's a very good funding mechanism because through joint actions, you get really close collaboration between the European Commission, the member states, and the external partners and experts. So RD Action our tagline is Data and Policies for Rare Diseases, and we actually came about through a marriage of two previous joint actions. Some of you will be familiar with the USAID joint action, which was all about creating policies for rare diseases, and Orphanet, which I think needs no introduction. Orphanet was also partially funded by a joint action. So back in 2015, these two joint actions merged together under a single joint action, RD Action, which is coordinated by Dr. Anna Rath, who is here with us today. We have three main focuses in the project. One is to continue to develop and to expand the Orphanet tools and resources. The second is to continue to roll out and to improve the implementation on the ground of the Orpha code, which has been deemed the most relevant and sensitive system for coding rare diseases. And the third main area, which is the strand of work that I've been involved in for the last few years, is around implementing and creating new policies for rare diseases. We decided quite early on, actually back in 2015, that a big focus for our work in this policy and integration sphere would focus on the European Reference Networks, or ERNs. ERNs, in a nutshell, are virtual networks connecting what we've always called in the rare disease field centers of expertise, so healthcare providers, HCPs, providing highly specialized healthcare. For those who are not so familiar with ERNs, you will get a much more in-depth introduction in the following presentation. But we've worked quite hard in RD Action across all the work packages, in fact, to really support the development of the ERNs. And in the earlier stages, this was quite a practical role in terms of helping to identify who might want to lead or participate in the networks. I don't have time to give you a full summary of all of these activities, but you can follow this link and you can get a good taster for what the partners have been doing. Really, though, when we got into 2016, we stopped dealing with theoretical networks and we began dealing with real people, real networks, and real coordinators. And so we adopted this guiding principle that as the ERNs are established and they evolve, dedicated guidance will still be important to support and also to ensure a baseline compatibility and interoperability at many levels and in many terms between the networks. So what does that mean? It means that ERNs are a fantastic opportunity to embed good practices and to disseminate these in our health systems and our research systems. Each of the networks, we have 24 networks, they're all very different, but they have a very long list of responsibilities and duties. It's a very ambitious mandate, and again, you will hear more about this morning. What we recognized, though, in the joint action was that each of these networks, each of these communities had a lot to offer and had excelled and had experience in particular activities, particular areas such as registry development, guideline development. And what we wanted to do was to work with those networks to help them to identify what practices are out there which could quite easily be applied to other networks so that we're not reinventing wheels and we're making use of the fruits of all of our past investments in rare diseases. And the main way that we do this is through a series of workshops. So our workshops are very multi-stakeholder. We involve RD Action, work packages and partners, especially Anna Rath as our coordinator, because Orphanet tools are relevant to many of these different duties of ERNs. And of course, our Eurodis partners, many of whom are here with us in the room today. We have a very nice collaboration. We've enjoyed a very nice collaboration with the European Commission, particularly with DG SANTE colleagues who've been very supportive, and increasingly with DG Research, because the ERNs really span this border, which is always a little bit blurred for rare diseases, but they span this border between care and research. EPAGs, lots of acronyms in these presentations. EPAGs are the European Patient Advocacy Groups, and this is the way in which Eurodis has sought to formalize patient involvement, real involvement in the networks. You'll hear more about this as we go along. Topic experts, ERNs are vast. We're talking about 1,000 units almost across Europe, but there are experts outside of ERNs, and so where necessary, we always seek to bring in experts who are not strictly enshrined within one of the HCPs which make up the networks. Member states are really important actors in all of this. The ERNs are pan-European, they're virtual networks, but the centres of which they are composed are of course grounded in the member states, and so it's really important that we continue to develop strong member state support. And the most obvious means of doing this for us has been the Board of Member States of ERNs. And last but not least, of course, the ERNs themselves. So we have 24 networks, 24 coordinators, and to make life a little bit easier, last summer they organized themselves into quite a detailed and ambitious governance structure, and you'll hear more about this as well. But what it means is that they have working groups where not every coordinator is focusing all the time on each of these many duties. They try to share some of these roles out. Now, for this workshop, our final workshop, we are delighted, of course, to have as an extra partner the European Medicines Agency, and I must thank all of the colleagues involved for their strong support and for giving us this wonderful building and these wonderful premises, so thank you. So these are the major topics of our workshops. We've also run a few smaller workshops on exploring engagement with e-health communities. You can find all of this on our website. And across these six major workshops dedicated purely on how the ERNs can do X, Y, and Z, we've had over 350 participants, which is great. So for example, virtual care. The leading question there was how can ERNs do virtual care? How can they do virtual consultations, which are very much at the heart of the activities. Here we are today. I haven't got a pointer, but you can see up there at sort of 10 o'clock. This is clinical research, how ERNs can do clinical research, how they can add value. So we tried to come up with some sort of sometimes reports, sometimes recommended principles, good practices, and very often these are practices or recommendations for future work, because all of these workshops are really a first look at these topics and they will require further activities in the future. You can find a summary of all the different outputs if you follow this link. This is our kind of homepage, and each of the workshops has a tab, and you can find all of these various sets of recommendations or draft tables of core indicators, etc. We really try to be very broad in terms of the topics that we look at. So the context for this workshop, as Valentina explained, this is the final workshop that we will run as part of our work package in RD Action. Why are we doing this topic? We're doing this topic because ERNs are first and foremost dedicated to care. This is very important. If done right, ERNs will be the ultimate equalizer in terms of opening up access to the best quality care for patients, no matter where you happen to live across Europe. But, as I said, one of the many goals that ERNs have is they have to contribute to world-leading research in their focal area. This raises really important opportunities, I think, for these European reference networks, which are multi-stakeholder, pan-European networks, to really truly act as game changers for rare and complex conditions. There's various reasons for this, and actually one of the things that we will do across the rest of today is to really crystallize what these opportunities are. But for an example, they are permanent. Providing they all pass their first 5-year evaluation, and subsequently, these are not projects that will vanish, they're here to stay. They have very broad, very comprehensive disease coverage. You'll see this from Maurizio's slide. But the idea is that across these networks, every condition, every rare condition will have a home in time. They're patient-centered. I've mentioned the EPAGs, but actually patients in terms of Eurordis 10 years ago brainstorming the concept of an ERN, all the way through to the actual structure and the governance of the networks now. They have patients or should have patients at all levels truly involved. This should not be a tick box exercise. They're built in some cases upon very mature research networks. In fact, most of the ERNs really come more from research networks than care. I think that's largely the case. So there are often some assets, there are some very valuable experiences which can be translated into this community. And as I said, because ERNs are new, this is an opportunity to really embed good practices from the beginning. So what we want to do is to really move from a general appreciation of, okay, these are the positives about ERNs, to how we actually get some sort of tangible benefit, what needs to be in place. So we have 4 broad aims for this workshop, which you have on your workshop outline, which is available on the desk outside. We want to share and discuss the state of the art in terms of tools and resources which exist already today, which can support and streamline clinical research. Secondly, we want to really introduce the ERNs in a different level, both to the colleagues in the room, but also to those of you following at home via the live stream. So what are the networks actually focusing on? What do they want to do around research? What are their challenges? What are their needs? Thirdly, we're here at the EMA. This is a fantastic opportunity to actually learn about all the different opportunities, all the different services and tools which are available through the EMA. And fourthly, and this is really a point for tomorrow, in fact, we want to try to put these together. We want to try and concretely identify how and where ERNs can make a positive difference to all sorts of different time points. Thinking about clinical research on a broad scale, what can ERNs do where, and what needs to be in place for this? So we're almost starting to sketch kind of a roadmap here. So how will we do this? Well, as you've heard today, is very much about setting the scene and establishing the status quo. So we have this session on the introduction and the context. Then we have a session which will explore really what the ERNs are up to and what their different needs and their plans are already 1 year in. And then we have a session to end the day where we have a really close look at the different EMA services and tools and resources. Day 2, tomorrow, is a closed meeting, and this is entirely debate-focused. It's all about discussion, and it's all about, having heard what the status quo is today, where do we want to go? How do we make the most of the opportunities that the networks offer? So these are our 4 discussion topics for tomorrow. Firstly, what sorts of activities under the heading of clinical research will the networks actually engage in? Secondly, what opportunities exist under the current EMA structures, and how might the ERNs engage with these? Thirdly, we're going to be identifying some concrete roles and recommended practices to involve patients in the various types of ERN-related clinical research. And finally, how can ERNs generate /link/exchange data to support the planning and execution of trials and studies? Data always comes up, so we gave it its own slot. So my penultimate slide, just a few words of, a few encouraging words, I hope, for the workshop. This is a very broad topic. So even clinical research as opposed to research is still huge. And it's also a first look, as I say. It's the first time the networks have come together to talk about this. So as you go through today, what I would love you to do is to jot down key points, key questions, key ideas, and try to relate those to one of the 4 discussion topics tomorrow so we can really bring these up. This is very much a participatory workshop. You don't want to just hear from all of us all day today and then all day tomorrow. We want everyone to contribute their suggestions, particularly tomorrow when we have lots of time for discussion. The outputs from the workshop are something that are actually still to be determined. We know that we'll come up with a workshop report, but what we typically find with these RD Action-led workshops is that, in fact, as we go along, people come up with really good suggestions for what would be needed. So perhaps we might do some sort of recommendations on how ERNs can engage with certain stakeholders. We might come up with a kind of a toolkit just to pull together all the different resources that are already there, which the networks can make use of. But this is very much up for discussion. So my last slide is that this morning we have 66 participants. 1 or 2 have had to drop out due to travel chaos and weather chaos, but we should have 66 people. We have 20 ERNs represented directly. We have 10 EPAG representatives. We have colleagues representing DG SANTE and DG Research. We have many EMA experts, and you can have a look at the participant list, which explains who's working in which teams. And of course, we have our RD Action partners and our topic experts. And as always, it's a real pleasure to work with them. So I just want to thank the members of our workshop organizing committee. We have the RD Action colleagues here. I particularly want to thank Hannah Murray, who cannot be here due to an injury. Thank you to Joanne for stepping in to help me on site. But thank you for your work behind the scenes, Hannah. Our DG Sante colleagues, again, Hélène will be with us very soon. Enrique Terol was very involved in the early planning of this workshop, so thank you to him. For the EMA, many colleagues have been involved, but thank you especially to Monica and Isabel and Ivana. And from the ERNs, our key contacts this time have been Luca, Maurizio, and Franz Schaefer. So I shall hand over here, I think. Thank you very much.
Thank you, Vicky, and perfect timing. And I'm happy now to introduce Professor Maurizio Scarpa. Yes, and Maurizio is, amongst other things, a director of the Centers for Rare Diseases Helios Dr. Horst Schmidt in Wiesbaden in Germany. He's also a professor for pediatrics at the University of Padova, and he's here today in particular as the coordinator of the European Reference Network for Hereditary Metabolic Diseases, MetabERN. It is also the chair of the ERN Coordinators Group. Yes.
Thank you. Probably too much. I'm happy to be here, and I'm happy to be here also as on behalf of the colleagues coordinators of the European Reference Network for this very important initiative. And I thank EMA and RD Action for this organization, because I mean it is an extremely important moment to link the clinical part, the research part with the agency in order to speed up all the organization and to optimize the coordination to discover new therapies, a new model of treatment for our patients. And I think that this, I hope, is a first step of a very long collaboration that we must have with the agency in order to really step to achieve the result that the IRDIRC asked us to create 1,000 therapies for 2020 for the rare diseases. And I think that the European Reference Network can be really a key point, a key actor in this work. And today, in this short talk that I want to have with you, I would like to go through a little bit the history, but also on what we have achieved already in the first year of activity. So just to give you an idea and to complete the history, the road to the European Reference Network starting from a patient action in 2002, when, as you know, a group of rare disease patients were tired to be treated as B-class, and they create a free movement that, together with the Commission, inside the Parliament, inside the Commission, inside Brussels, brought bottom up the problems of the rare disease patients in order to be treated as everybody else. And indeed, they were extremely successful in sensitizing the community and in creating key activities and key working groups that brought in 2011 to a very important moment, the creation of the directive for the cross-border healthcare. For the first time in the world, every country can actually have the opportunity to treat their patients in other countries if the therapies, do we have some time? Okay. If the therapies are actually not available. So after this very important moment, the creation of the group of experts for rare diseases was crucial, because this group of experts divided the different rare diseases in 21 almost homogeneous fields. And according to the directive of 2011, in the Article 12, there was already an embryo, the European Reference Network Constitution. And the fact that the USERD was dividing the different rare diseases in different fields asked for the creation of a European Reference Network per each of these fields. And this is an important thing because, I mean, the rare diseases are about 7,000, and so to at least have an idea how to address the 360 activity around the patient was extremely important. The concept of the European Reference Network is very clear. It is really a sort of atomium in which you have the patient connected with clinicians and all the stakeholders in collaboration with this binomium. The agencies, the research, the payers, the public health, and the providers, the centers of excellence, all working together as a critical mass to create the best for the patient. It is not a project, as Vicky was saying. It is not a project having a hand. It is a concept. It is a new way of making medicine that probably is also an example for other more common or more complex disorders in the health system. The proposal that was launched by the European Commission was very much more successful than what it was expected. We had 21 chapters, but actually we have 24 European reference network, and we did not expect so much enthusiasm and so much collaboration and commitment for a concept that is not granted. Usually, it is very easy to find the partners if you have a big grant. For the European Reference Network, the grant was not the major stimulus, but it was indeed the vision and the new idea of working together. We all work together, but I mean, this is a way to officialize and to really have the opportunity to have a feedback of experiences and to grow. Here, the 24 European Reference Network answered in a proper way to the request of the proposal. And the major important thing is that this patient, which is one of my patients that was really treated inside the metabolic unit, now has an opportunity, because actually he is not benefiting only on the multidisciplinary team from the metabolic field, but it is also benefiting by all the expertise of the other MetabERN. So at this point, the patients are really in the center of our activity, and the ERN are not silos. I will show you that we are all working together, indeed, to give the best expertise to all our patients independently from the disease and independently from the ERN of appartenance. We had 1 year and 2 months ago a very important event in Vilnius, where there was the award of the European Reference Network. The application was very complex, and I have to say, this day that we spent with more than 600 people, 400 from the European Reference Network and 200 from the community, was very rewarding, because it was a very, very hard way to create the application and to make a proper proposal for the ERNs. It was really a feast. We were all very knowledgeable people, behaving like children under the Christmas tree. And it was really a feast. And a lot of you were in that moment. And I think it was very touching to see, for example, to hear the message of Jean-Claude Juncker, but in particular, the commitment and the feeling and the emotion of the Commission and Eucaritis when he was really awarding us one by one. And this commitment is not finishing, and it is really a major push for us to do better. At the end, what we are 24 European Reference Network in 26 countries. Altogether, we are 300 hospitals in Europe. These hospitals have been endorsed by the Ministry of Health of each country, and we have more than 900 specialized healthcare units. Bringing this concept around the world, I spoke about this in Australia, Russia, and US. This is something that really is impressive. And there is very much interest from US, Australia, and Russia to try to replicate this model, because for the first time we are able to see that we have a network of 300 hospitals of excellence. The distribution in Europe is quite good. Beside Malta, Greece, and Slovak Republic, we have all the other member states represented with all their best units. There are, of course, Italy, Spain, UK, Germany, and France as the biggest countries contributing to the European Reference Network. These are also the countries in which the tradition of the rare diseases is quite important. There are, although, some countries like Austria and, and Ireland that are much less represented than what they should, but you have to remember that the application to be part of a European Reference Network is not only based on the excellencies, but it is also based on a political choice. And for this reason, Austria and Ireland has chosen to participate for some and other for some not. European Reference Network, and I hope that in the near future there will be an expansion also to the countries that are not properly at the moment represented. As I said, the patients are at the center of our activity. This is just a very complicated slide representing the major activities of the patient organization and the EPACs inside the ERN, to advise the activities in order to be transparent, in order to have a proper planning and how to assess and evaluate the activity, to ensure that all the ethical issues and also the patient perspective and the patient pathway are respected inside our activity, to monitor that the patient involvement is really ensured and that there is an empowerment of patient in order that the results that we are producing are really the benefit of the patient, and to evaluate that actually we are working properly, because I mean now we have to really switch the coin. It is not the physician imposing to the patient what he's deciding, but it is a partnership with patients in order that diagnosis, management, access therapy are really properly achieved. I will give you now just an example of the complexity of the ERN, and I speak about the ERN I'm honored to coordinate, just to show you this. You can expand 24 times how the complexity of the things it is. Metabolic disorder was very simple 100 years ago when Archibald Garrod actually thought that some diseases running in a family could be of metabolic origin. He was just studying 4 diseases, but from that, and only for 4, he was created this inborn error of metabolism word that now is the leading word for us. After 100 years of age, the metabolism is much more complex. This is the metabolic pathway that we are dealing with, and if you just highlight a small pattern, you see the complexity of the enzymes, and for each enzyme we can have a disease. As a matter of fact, we have more than 800 diseases to take over, and 60 of them involve the CNS, and 30 of them involve all the organs. So just to give you an idea about the complexity of the topic that we are dealing. And I have to remember when Enrique Terol for the first time was calling a small group of people to discuss about the European Reference Network, I was really scared to think and to know how to create a European Reference Network for such a complex environment. Nevertheless, it was extremely easy, because I mean the concept of the European Reference Network was extremely understood by all the partners, and we succeeded in having 69 providers, hospitals in 18 countries, with the approval of our scientific society, and having and being able to divide all the different disorder in homogeneous subnetworks that are actually working together with some activities that I will illustrate later. There is a scientific board in which the patient organization are working with us in the governance, and every subnetwork is can work alone, but they are working together with the common activities. Just to give you some ideas, inside the network we have 1,681 experts. We are collaborating with 47 patient organizations out of the 250 metabolic that we have now, but these are the patient organizations able to work at the international level by now. We have represented all the different multidisciplinary activities that are important for the patient. 50% of us are doctors, another 50% are from psychologists, paramedics, and students. And if we see the disciplines that the doctors have, you see that there is no specialty that is missing in this group, so that the patient really can be followed properly. We are following about 43,000 patients by now, 2/3 of which are pediatric and 1/3 of which are adult. The European Reference Network do not have limit of age, And the major advantage we have is that we can recognize how many patients we have with all the clinical histories, and we can really contribute to set the clinical trials with small but not so small communities. For example, I have here the CDG, which is very extremely rare, and of that we have 407 patients, of which we know exactly the clinical summary, their history. So this is a major tool in order to develop the therapies and in order to discuss with scientists the way to make a better therapy. So just to give you an idea, the potence and the strength of for the clinical part. The activities of the ERN, present in the MetabERN but also in the others, is very wide. In metabolic, we have the advantage to have prevention and screening. We have a newborn screening. In some countries, we are obliged to have a newborn screening for 47 diseases. We have groups working on diagnosis and new diseases determination. And then the epidemiology and the registries is a major part. The European Commission was launching before the ERN a call for registries, and 5 European reference networks were successful in having the registries. These registries will represent the starting point of a common rare disease registry that we are aiming to develop in the next years. Of course, the management, the guidelines, and the clinical pathways are important, and I will concentrate some part of my talk about the virtual counseling, because this is really a major point that we have achieved so far. The European Commission at the beginning wanted indeed having the virtual counseling as one of the major activities of the European Reference Network. In November 2017, the European Commission was successful in releasing the 1.0 edition of a platform on which we can upload any data from the patient, from ultrasounds to MRIs to blood tests. It is for the first time a platform that can be shared without any problem of data protection and security, all the data of the patients, in order to create a task force to better understand the diagnosis, the treatment, the approach for rare diseases. And this is a platform that can be activated by all the providers in the ERNs. And at the moment, this is the report of April. What it's important is that we had something like more than 100 patients discussed, and we had about 800 units that have been working with that, and we had closed partners that really were helping the patients with their request. The nice thing is that the outcome of this discussion is a sort of certification that can be released and put inside the clinical summary. So it is a very nice way of having an international counseling for particular difficult patients. Everybody can have access to this platform. The European Reference Network, of course, are the owner of the platform, but they can help all the patients that need, according to the fact that there is an informed consent signed. The European Reference Network coordinators are working together. This is a major activity we have. We have a group from June 2017 of 24 coordinators who has which has a governance with a chair, with a vice chair, and different working groups that are discussing about common things. We have a working group about IT that was instrumental for the Commission to ameliorate, optimize, and still work on the platform, and Ruth Laderstein from the ERN is the coordinator. And especially now, after 25th of May, this working group was extremely important to give clues how to solve the problem of the data sharing. The research unit is run by Eduardo, and I think that together with Luca as liaison for the EMA, the fact that we are here today is already speaking for itself about the success and the commitment of this group to take the possibility represented by the ERN for the research. Nicoline Hogerbrugge from Genturis was successful to create, together with the legal aspect and ethics group, to create a conflict of interest document that will allow us to work with companies and third parties in order to really have a transparent activity and achievement of translational. With Holm-Gressner, we are facing the Brexit problem. In June, we will start to speak about the Brexit because 6 out of the 24 coordinators are from UK, and we need actually to see what we can do for that. Christoph Chappell with Eurogene has been successful in creating a document about how to monitor the activity of the European Reference Network, and that will be a document also that will be approved inside every ERN in order to have a day-by-day monitor of the activity. Paolo and his group is actually creating guidelines, education and training systems in order that we ensure the future, and we are creating workshop and activities to attract on the rare diseases the new generation of physicians. There are then special projects about NHS integration and sustainability, which is really a major topic. It will be a long discussion topic. This is a topic that we are discussing with the board of member states, and I will continue to coordinate these in order to ensure the future also on the financial way for the future. This is what we have achieved in just 1 year. As you see, the green are the spots in which we have documents, we have clear idea, we have clear discussion and consensus about this point. Teaching, of course, is something that is still under discussion because it is related to the different country organization. And of course, Brexit, NHS integration, and sustainability, as I said, are major topics that require a lot of political discussion, but I'm sure that this will be achieved very soon. If you see, this activity have been achieved by a coordination of different points. And what I invented was the ERN interactome. Here, every number is actually connected, not casually, but in a proper way. And going through this guide, we were able actually to have as a green points a lot of activities. I presented this interactome in Vilnius in March, and this was the situation. You see that here you have a lot of greens, here you have a lot of red. It means that only in 1 year we were able to step forward to achieve a lot of consensus that all together, this is the beauty of this concept, all together is helping the different countries and the patients in the different member states. There is a lot of work in progress. We are lucky that the board of member states are interviewing us every time they meet, and we meet so that we have a constant activity, and every almost 3-4 months we update the board of member states with our achievement, with our problems in order to discuss problems. There is a discussion about sustainability because, as I said, the grant at the beginning was really minimal, and we need, but now we start to discuss also how the future will be. The integration into the national health system is crucial because we are making not an alternative medicine, we are actually working for the national health system. And then we have, of course, also the reimbursement and the other activities that we are discussing with the board of member states. The activity of the European Reference Network Coordinating Group is also to participate in important meetings for stakeholders and policy meetings. For example, we had a very nice discussion in collaboration with industries in September last year, organized by Eurordis, and last year in Gastein, I participated to several workshops to discuss about the ERN to the European Health Forum, and also this year, Luca and myself will be in Gastein to discuss about the European Reference Network and the health systems. The activity is also awareness, and it is also the demonstration of results. For example, we had one very important event in the European Parliament on the rare disease. Luca is a group on behalf of the other coordinator point out the need of diagnosis of rare diseases. It was extremely successful. A lot of member states a lot of members of the parliament and patient organization. The commissioner was really touched by the whole, and he was indeed on the same day releasing in the Parliament magazine a statement of commitment and a statement of how important are the European Reference Network for the society, for the patient, and for the public health. In summary, what the ERN can represent? They are major opportunities for patients because, of course, they optimize care pathways. The creation of database registries will allow to the scientists and to the third parties and to the industries to better understand which kind of development of therapy they need to do. For the patients, it is important to collaborate with clinicians in order not to be the last of a chain, but to be every single ring of this chain in terms of participation to diagnosis, to the management, to the treatment, but also to really tell us what is important to be checked in the clinical trials in order to understand how the therapies can be important. The empowerment of the patient is really a major activity of the ERN, and the collaboration with the organization is extremely important. Another major achievement is that the patient organization are not very much used to work together. They are very much interested in their own activity, in their own disease. Now they have the opportunity to discuss with other patient organizations, with other needs, in order to create common plans that are important for a benefit, a global benefit for rare diseases. And this is a major achievement, because to have inside the ERN different patient organizations from different diseases and speaking about common problems and discussing about common needs is a way to progress for the treatment. For the national health system, the European Reference Network need to be seen really as an opportunity, because, I mean, first of all, there is a spare of money. Patients are not going throughout Europe anymore to replicate, duplicate the diagnosis and spend a lot of money for searching a therapy. Now there is a tool that can be used by all European member states to help the patient to have the diagnosis at a better care. Of course, the organization of this critical mass is important to impact about the awareness and rare diseases, to create common registries, databases, natural histories, and it is impacting also on the European health technology assessment in order to calculate better the cost of the management of the patient and also to predict the sustainability of the rare diseases. A major problem now that we have is the orphan drugs cost, and the fact that some countries are indeed thinking to withdraw from giving some therapies to the patients. With the European Reference Network, we can generate data that can help the national agencies to understand exactly, about these problems. And the interaction with the single national health institutes and agencies and the agencies for drug, it's important in order to better have studies about post-marketing analysis and understand really what is the benefit of all the therapies that are now approved. And this, I think, is extremely important. For the EMA, the European Reference Network can represent a bulk of experts that can be interviewed and can be approached and can be asked to participate for the discussion in all the possible panels and committee to discuss therapies and to discuss the different clinical trials. In conclusion, I mean, one important thing is that when we are speaking about the European Reference Network, we are not thinking that it's a program of 5 diseases. It is a concept of new disease or new medicine. The European Reference Network, for the first time, are grouping all the centers of excellence that are qualified by the different Ministry of Health. And these 300 hospitals and 1,000 specialized units are just the first group. We are discussing with the Board of Member States, the European Commission, the opening of a second call that will be probably launched in the last part of this year or first trimester of next year, in order to include new expertise and in order to include countries that can really benefit from the European reference network concept. It is a multidisciplinary team, so there is the need of everybody. I mean, we are not only clinicians, we need everybody, all the stakeholders, in order to really achieve our result. It is, as we said, an important concept for the Commission, for the health system, for the patient organization. The European Reference Network are a meeting point of a lot of interest in helping and a lot of interest of developing therapies and trials. And for the important thing is that the European Reference Network Coordinator Group is really a very friendly task, working all together for the benefit and for the interest of all the patients, independently from the disease and independently from the country of origins. And I think that this is a concept, it is a program that really need the help and the commitment of all the scientific and medical community and patient community, because it is an example that can be expanded to other fields like cardiovascular neurodegeneration or diabetes, and we hopefully we will be able to expand this concept also to other continents to increase the expertise and to have a globalization of treating patients and serving the patients. Thank you very much for your patience.
Thank you very much, Maurizio. So now we will move to the presentation from the European Commission. So you said that these ERNs are a direct implementation of the cross-border healthcare directive, so it is important to listen to the Commission. But what is really interesting today is that we have 3 representatives of the Commission from the Unit B3, Cross-Border Healthcare and E-Health, from DG SANTE, from the DG Health, Food and Safety, DG SANTE Unit B5, and also from DG Research and Innovation. So we were supposed to listen first to Hélène Borgne, who was supposed to give us the state of play from the cross-border healthcare and e-health unit, but unfortunately it seems that there is some problem with the Eurostar. She's not yet arrived. But I don't think it's a big problem because we can start with the research aspect, which is very important in the context of today's workshop, because we want to talk about clinical research. So I'm very pleased to introduce Eerola, who is a scientific project officer in the Innovative and Personalized Medicine Unit in Directorate Health, DG Research and Innovation. Please.
Yes, good morning to everybody, and thank you very much for the introduction and invitation to speak here. So I will start this state of play presentation from the European Commission services by giving the perspective from the DG Research and Innovation side. In this presentation, I'm going to talk about recently started Horizon 2020 projects which involve European reference networks. And then I will highlight some topics for potential future activities which could be relevant for ERNs as well. But first, as an introduction, this slide shows an overview of the activities of DG Research and Innovation in the field of rare diseases research. The main activities direct funding for research and innovation projects. More than 200 projects related to rare diseases have been funded in FP7 and Horizon 2020 up till now. The total EU contribution to them is more than 1 billion euros. To briefly said, these projects have increased our understanding on the pathophysiology and natural history of many rare diseases, and these projects have also delivered new diagnostic tools and therapies for many diseases. I want to mention one example, is LAMSEDE, enzyme replacement therapy for alpha-mannosidosis, which got the marketing authorization just in March this year. The early phases of the development of this product was done in 3 consecutive EU-funded projects. EuroMan, HUMAN, and AlphaMan were the names of the projects. They brought the development to the level of early clinical trials. Then after that, Chiesi Group from Italy took over the company Simenex, which had the IPR of the product, and Chiesi took it further, the development to the later clinical trials, and finally up to the level of marketing authorization. Then the second important activity for the EC in this field is the coordination of national research activities. For this, we have collaboration of more than 10 years in the form of ERNs, projects. They bring together national funding agencies, and they have funded more than 100 collaborative projects in the field of rare diseases. You can find the information about these funded projects on the ERN website. We have to think beyond Europe in this field, and the Commission was the driving force behind the establishment of the International Rare Diseases Research Consortium, ERDIRC, established in 2011. It brings together nowadays more than 50 organizations investing in rare diseases research from 5 different continents. As the original goal of having 200 new therapies was achieved already last year, ERDIRC has updated its goals. Maurizio already referred to some of them. The goals are that all rare disease patients would have diagnosis within 1 year, coming to the attention of a specialized clinic, to develop 1,000 new therapies and methodologies to measure the impact of the new therapies and diagnostic tools on patients, so by 2027. I want to mention here that international collaboration between clinical research networks has been identified as an important area to be worked on in ERDIRC. A specific task force has been proposed for this topic. This is still in the pipeline, but if this materializes, then of course it would be important that the ERNs play an active role in there. Then moving to the Horizon 2020 projects involving ERN participants. So the 2017 calls had a specific topic for diagnostic characterization of rare diseases. 2 projects were funded in this topic. One is SolveRD. There, the aim is to solve large numbers of rare diseases by combined omics approaches. This project is coordinated by University of Tübingen, and it involves 4 ERNs, which are indicated here in this slide. They provide key clinical genetics and diagnostic expertise to this consortium. It will be a staged approach. The plan is that SolveRD will reach out to all ERNs during the course of the project. So SolveRD has access to about 19,000 undiagnosed cases. These are mainly coming from these 4 ERNs involved. They are going to reorganize the phenotypic data from these cases and they will look for new phenotypic patterns. They are going to reanalyze the genomic data that is already available from these patients. They will create a lot of new omics data, whole genome sequencing, other omics, and they will also look for matching cases and run functional analysis to confirm some of the variants. They will also study clinical utility and cost effectiveness aspects of these new multi-omics approaches, and in which then ERNs will play an important role. So very active participation of ERNs in this new project. Then the second topic, project funded from the same topic is called Immune Aid. It focuses on systemic autoinflammatory diseases. The challenge here is that patients with these diseases have a large number of unspecific overlapping syndromes, and there are no disease-specific biomarkers for these diseases. So exact disease-specific diagnosis is very challenging here. So this project is again going to apply a multi-omics approach in order to identify and validate new diagnostic biomarkers and also clinical decision-making algorithm for these diseases. The project is coordinated by INSERM in Paris, and it involves several centers from the ERN RITA. The 2017 calls included also a specific topic for new therapies for rare diseases. There altogether 10 projects were funded, 8 of them involve at least one center from an ERN. In these 2 slides I have listed those which involve ERNs. In this slide you can see the projects working on gene cell therapies, and then in the second slide you have the projects which are working on the other type of therapies. You can find more information about these projects on the Cordis website. Then finally I want to move to the topics for potential future projects which would be relevant for ERNs. The Horizon 2020 work program for 2018 and 2020 includes 3 topics which refer to European reference networks. Many of you have heard about the Rare Disease European Joint Program Co-Fund. This topic aims to launch a joint program between the Commission, Member States and associated countries, which would establish a research and innovation pipeline which would bring results from research more efficiently to the clinic, to the benefit of the patient. Here, in addition to the research funding program, this program should also build a virtual platform for rare disease research data, tools and standards, which would also include testing and piloting of such tools in a clinical setting. It should also run a capacity building program for training, for example, on product development, management of research data and HTA aspects, for example. It should be a sort of connector, connecting important activities in the field, and it should build strong links with European reference networks as well. The second topic which refers to ERNs is for HTA research to support evidence-based healthcare. The idea here is to develop new or improved frameworks, methodological frameworks for HTA. and to support consensus building in this field. Now it's to be mentioned that these two topics, they had already the deadline for proposal submission in April. So the Commission is currently working on the proposals, and the results will be released at the latest in September. Then we have a third topic. It is for next year, deadline in April next year. It is for innovation procurement. The idea is to support the implementation of next generation sequencing for routine diagnosis in personalized medicine. So this would support joint procurement of NGS technology to be implemented in the clinical setting. And since these procurers are most likely to be healthcare providers, it could very well fit also to the ERNs to join this kind of project. It's to be mentioned that the work program includes also many other topics which could potentially fit to your research interests, so it's worth going through the full work program. So I will stop here. Thank you very much for the attention.
If you can switch off the microphone, please. Thank you very much. So we are now very happy to welcome Hélène Borgne, who will now present the perspective from DG SANTE, and you come from the unit B3, the cross-border healthcare and e-health.
Thank you very much. Good morning, everybody, and thank you, Iiro, for being ready to step in because my Eurostar was too late. Good morning to all persons in the room, but also to all persons following us today in live streaming. And that's a reason why I'm also explaining things that people in the room might know already by heart, but I think it's important to remind key principles about ERNs. What are we speaking about? ERNs, let me come back. Yeah, I would like to come back. ERNs, first of all, have to be seen as a construction from the healthcare in the European Union. This means we have here different national competencies and systems with different rights and different models. This is based on the subsidiarity principle, and the healthcare cooperation for ERNs is based on the voluntary participation. To be noted as well, the ERNs are based on the Cross-Border Healthcare Directive, which is the only legislation at EU level addressing healthcare. And it is meant to facilitate the mobility of patients across borders and to strengthen cooperation at EU level. What are ERNs specifically? These are networks of healthcare providers aiming at improving quality and safety as well as access to highly specialized healthcare. This is meant for patients affected by rare disease or rare conditions and complex. The principle is multidisciplinary approach and added value at EU level. This is so because of the need of cooperation due to scarcity of knowledge, the need of education, as well as complexity and high cost necessary. The rationale behind the ERNs is that many of us affected might not have access to a high quality diagnosis or treatment, and the expertise and specialist knowledge may be scarce. Therefore, we all know no country alone has the knowledge and capacity to treat these patients. That's why there are also some delays in the diagnosis and sometimes a lack of capacities to diagnose or treat. Concretely, what are the ERNs? And the principle behind the ERNs is that the knowledge travels, not the patients, or only in the case this is necessary. This means that the exchange of expertise and the clinical data on patients go via IT tools, via e-health and telemedicines, and there should be a swift and smooth contact between the providers. This means collaborative actions, and this means a need for networking activities. This should go through virtual care, through remote monitoring and follow-up and remote guidance, and the patient will be referred via the national healthcare systems, via the national pathways, through the national healthcare providers. This means that the case forwarded to the ERNs will be the most complicated cases where no possibility or a second advice is needed after the national level. The specific ERN will develop clinical guidelines. They will help in terms of research and innovation, training, generation, and sharing of knowledge. As said, the telemedicine and IT tools are very important, and the case that will be enrolled into the ERNs, so on the IT platform of the ERNs, will be enrolled through the ERN members, so referred via national systems. Concretely, the call for ERNs in 2016 ended up in 24 networks with more than 900 healthcare units from 300 hospitals over 26 countries in Europe. Here you have a picture of the PROD coordinators with the EU Commissioner for Health at the kickoff meeting last year in March 2017 in Vilnius, where some of you were present. And very concretely, these are the 24 ERNs. Many of you are in the room, and I know that many of you are also, I hope, following by live streaming. We cover a very large, very broad range of diseases and conditions. The ERNs have actually a long life cycle. They were not born in one day. As you know, many of you were involved already years ago. It started with the legislation and initial planning, 2011 to 2014, with a directive, with implementing decision, but also with awareness and communication to build the networks and to avoid to have different networks covering the same diseases, so to have synergies. Then we had the implementation stage for the approval, with the designation and development of assessment tools, the call for ERNs, the assessment of network, and their approval in December 2016. And now in 2017-18, we are at the deployment stage with the establishment of ERNs, the first initial organizational phases, the functioning with initial actions, and partial service production. The full consolidation will happen within the next 2 years. And then we'll go to evaluation and update, and we'll go for another life cycle of the project. And for research, this means we are still also at the deployment stage. Now, I would like to mention that in addition to the Commission, which initiated the project, thanks to patient organization, member states who were willing to share their expertise, we have different actors involved in the ERNs. Of course, the ERN members, so the healthcare providers, of course, the coordinators. But the member states have been detrimental to put the system in place based on the voluntary cooperation I mentioned at the beginning. So the ERN board of member states had approved all the networks, but every healthcare provider was also endorsed at national level. Now, since approval of the network, we have also set up an ERN coordinators group, which meets regularly, often back-to-back to the board of member states, to discuss common objectives, common needs, common questions. And also very important, patients organization, professional and scientific organization, as well as projects like RD Actions, which were very supportive in helping the networks on many different aspects that are important for the daily life and for the future. This is now the IT platform I mentioned earlier, the clinical patient management system, which is now operational since November last year, and the pilot phase was until February. So you see we are really in the implementation phase. And other modules need to be developed, thought about. And there is also another tool for communication and collaboration. Now I know many of you are thinking about money and how to sustain the networks. So first of all, the network are supported through the EU Health Programme with annual grants given to the coordinators to support coordinating activities. The IT aspects and help desk and so on are supported with the Connecting Europe facility, the CEF program. And you heard with my colleague Eerola from Horizon 2020, and in the future there will be also other research programs which certainly will be able to support ERNs. Now let me come to research. That's the topic of today. ERNs have key elements for research. They are a framework for structured cooperation to maximize the cross-country expertise. So they are an opportunity to build top-level research. And they will help also to disseminate research results, education, and training. Why is it so? Because already in the legislation, one of the key objectives of the network was research. Also, provision of care is the first primary objective. Provision of care or of advice on treatment and so on. But you see in the other objective mentioned in the legislation, you also have knowledge sharing, improvement of diagnosis, so also research elements. Registries might also be a very important aspect for ERN in the future because patient data is a mine where you might learn from each other and also reach the necessary scales to analyze efforts. So now, more concretely, we are just at the beginning of the story for ERNs and research. Of course, with a workshop like today, we will explore interactions with EMA and clinical trials-related initiatives and others. There might be also potential for interest in non-commercial research. But first of all, my message for today would be we need to let the member states set their agenda and map and build their own research capabilities among themselves, internally to each of the ERN as well as group of ERN. As group of ERNs, first of all, within each ERN, many of the ERNs have established thematic groups in terms of diseases, and most of them also a transversal working group on research or on registries. Therefore, a coordinated approach within the ERN is needed, starting by probably mapping what has been done, what is ongoing already. Some ERNs have done it. Some are still in the process of doing it. Some have not yet established working group on research because they think the first focus should be care. Now, as group of ERNs, thanks to the working group on research, we will also move towards a more coordinated approach. And thanks to the early action of workshop of today, we will have a survey on the need of ERNs. I will just mention very quickly the need to coordinate with the working group on ethics, as well as with the ERN board of member states. Later on today, we will have a presentation of the statement on industry. And to sum up, collaborative efforts on the way, needed. And this will help us to reach the expected impact for patients, professionals, as well as for the healthcare systems. Thank you very much. I was quick. I hope that was clear.
Thank you very much. Yes, unfortunately, we have to stick to the time because there are a lot of speakers today. Our last speaker, which I don't have anymore here, will be Anneli Torronen, who is a policy officer and seconded national expert in DG Santé Unit B5, the pharmaceuticals, which is particularly relevant for the work of the European Medicine Agency. And so she will mention how the whole thing fits within the pharmaceutical legislation. Please.
Good morning, everybody, also from my side. And as was already presented, I come from the unit in the DG SANTE, which is responsible for this marketing authorization, the decision-making, and also medicine policy. And I'm finishing this trilogy from European Commission presentations, a little bit like snapshotting this area of medicines, which was already highlighted because we are now in the European Medicine Agency premises, and with all preceding presentations, quite many of those reference networks are also touching the area of medicines. And actually, I'm having a very simplified picture here, what is trying to a little bit describe of the life cycle of medicine, and how the European reference networks are part of this cycle. Of course, in the first initial development phase, which might be very tough, very long, needs a lot of research, it's not of data. It's no questions that all data which these kinds of establishment and networks are bringing are very valuable. If we are lucky, we succeed and we get the marketing authorization. Every medicine which is on the market has been assessed, efficacy, safety, quality, they have to have been demonstrated and they are assessed very carefully. The marketing authorization can be granted centrally or nationally, but anyway, then actually the real thing actually begins, because the real world data is coming from the use, and the monitoring phase, which is also including pharmacovigilance and all kinds of these things. I think these kind of networks which you are establishing is bringing the so valuable data of the follow-up and the signal detections which might concern efficacy or safety or some other aspect which might then give push to new development phase. This very busy slide actually tries to demonstrate the pharmaceutical legislation. It's quite broad, but the core is actually 2001/28 EC directive. But I tried to pick 3 kind of areas which more touches the European research networks, and they are in the order of the chronologically order: orphan regulation, pediatric regulation, and ATMPs, advanced medicinal trade products. The orphan designation can be granted with the rare disease context, which is probably very familiar to this audience. The pediatric regulation tries to identify the needs of the pediatric population, and the advanced therapy products are in the area of novel therapies. Especially in this context, the clinical trials are very important. And because clinical research is much more than the clinical trials in the medicinal products, but I mean quite a lot of the clinical trials are dealing with the medicinal products. So that touches very closely to these development phases. And actually, a product can be involved in all these regulatory phases. It can be an ATMP product, which is assessed like the advanced medical therapy product, but it might have an orphan designation because it's indicated for a rare disease area, and in addition to the pediatric population involving the pediatric investigational plan. The legislation is also not like a static thing. It also tries to identify the needs and be on in the development of the field. So starting with the ATMPs, it has to support the development with the current legal framework. Quite currently, EC-EMA Joint Action Plan was published, which addresses 19 action points for the ATMPs during the 2 years of period. Then specific good manufacturing framework has already been adopted, and we are getting to be adopted good clinical practice for ATMPs. This is not going to be standalone guidance, just focusing on the ATMP specificities. Increased harmonization practices in the field and increased clarity of regulatory expectation of requirements is also in the focus. And my last slide is just trying to a little bit put inside of the 2 other regulations, orphan and pediatrics. orphan report was published quite recently. The pediatric report was published quite recently, and the orphan study will be started. And we just yesterday actually published the incentive study. We also heard in the welcoming words that there was EC pediatric workshop, which also tries to identify more the pediatric needs towards the collaboration internationally, and also try to improve the PIP procedures. With all of these, I think the European Research Networks is part and very, very much in the play. Thank you very much.
Thank you, Anneli, and thank you to all speakers. So far, we have got a comprehensive overview of not only ERN, but also the environment surrounding them. As coffee break approaches, we would still like to take one, maximum 2 questions, but just for clarification, reminding you that tomorrow we will have ample opportunities for discussion. Any question? Yes, please.
Thank you for the nice presentations. Maybe a naive question, but...
Can you introduce yourself?
Sorry, Dan O'Connor, UK representative on COMP, which is the Orphan Committee. It may be a naive question, but in terms of research, I was wondering who actually owns the data from the ERNs and who can access the data from the ERNs, because it'll be really important, I think, for the future discussions and the other context of the other presentations in terms of understanding how the data might be used in the future. Thank you.
Who wants to answer? Maybe it's for another session? Or maybe you want to?
I think possibly Luca has a comment. I suppose it depends on the type of data, because the ERNs are in a unique position to collect data from all over and to retain it, or at least have it pass through many different systems. So one would be the CPMS, the Clinical Patient Management System. Other resources would be registries, and you have the data coming into the healthcare centres themselves. But maybe, Luca, do you have a comment?
I mean, speaking about data, it's a universe, to be honest. It's like, we are collecting many different kind of data, as Vicky was mentioning, and then it depends from ERN to ERN how this kind of collection is going on. The second point is that we are dealing with the new directive on privacy, and to the modification to that directive that the national authority will give eventually. So we can be affected also by this aspect. For instance, for the CPMS system, the system that we use to exchange and to discuss the clinical data, we had to go through many different passages, also at the national level, in order to get authorization on how to use this data. So I would say that we can stay in this room for at least a couple of days discussing about this issue of the data. It's so wide that it's difficult really to concentrate for an answer, for a concrete answer. We are trying to organize that in as much as possible in a way that it could be feasible to exchange data between all the different ERN. But to be very honest with you, the only system that currently is in place is the CPMS, that is the system to exchange information on patient. And that's devoted to care.
Okay, we can stop now and have our coffee. I know there is another question. Shall we keep it for? Is it?
Josie Droughwell, ERN Rita. I think it was Dr. Scarpa who said that all patients who live with a rare disease would benefit from the ERN. But what happens if a patient lives in a country with a rare disease where that ERN is not represented? How can it benefit them?
The concept of the ERN is inclusion. So we are not close to any request of help. If any country is actually requiring a counseling for a patient, the only thing is to refer to a member and to open a CPMS session. The guest will be given an access to the CPMS and for the time being of the session. And the task can be created and can contribute for the question.
If I can complement, there will be also the status of affiliated partners. For countries which for the moment have no member in the ERN, there will be the possibility to have an affiliated partner in the network to be able to refer patients to the system. But it's not yet in place. That's why I was mentioning earlier, we are still in the deployment stage.